Now comes the insulin and other glucose lowering drugs, which are also called hypoglycemics and are used to treat diabetes and related disorders. In the insulins, we have three types of insulins: rapid and short acting insulins, intermediate acting insulins, and long acting insulins. In the rapid and short acting insulins, we have four types of insulin. Number one is the regular insulin. We have regular insulin, then we have insulin aspart, then we have insulin glulicine, and insulin lispro. So we have regular insulin, aspart, glulicine, and lispro. These are the rapid and short acting insulins. And in the intermediate acting insulin, we have just one, and that is NPH insulin, while NPH stands for neutral protamine H-DON. And in the long acting insulins, we have two, which are insulin datimir and insulin glargine. Now we comes to the amylin analog, and amylin analog there is just one, and that is pramlintide. Now come an important class of the drugs which are called oral agents or oral hypoglycemics. In the oral hypoglycemics, we have further insulin secretagogues, then we have insulin sensitizers, then we have alpha-glucosidase inhibitors, and finally we have dipeptidase 4 inhibitors, right? And in the insulin secretagogues, we have two types of drugs: sulfonylureas and glinides. In the sulfonylureas, there are two generations of sulfonylureas. The first generation is just one drug, and that is tolbutamide. In the first generation of sulfonylureas, we have just one drug, and that is called tolbutamide. While the second generation sulfonylureas are easy to understand because they are just three drugs and all start from G. And these are the second generation sulfonylureas: glimepiride, glipizide, and glyburide. These are the second generation sulfonylureas commonly used. And in the glinides, then we have glinides. In the glinides, we have netiglinide, and we have rapaglinide. Netiglinide and rapaglinide. Then come the insulin sensitizers, and in the insulin sensitizers we have bigonides. And in the bigonides there is just one drug, and that is very much important and commonly used, and that is called metformin. Metformin is a bigonide, which is insulin sensitizer. Then are the thiazolidine diones, which are also called glitazones. And in the glitazones, we have three glitazones, which are pioglitazone, we have rosiglitazone, and we have troglitazone. And then we have alpha-glucosidase inhibitors. In the alpha-glucosidase inhibitors, we have two drugs. In the alpha-glucosidase inhibitors, we have two drugs, which number one is acarbose, and the second one is meglitol. These are the alpha-glucosidase inhibitors. And then comes the dipeptidase 4 inhibitors, and there are two drugs in this category, which are sexagliptin and sitagliptin. So these were the oral hypoglycemics. Now comes the incretin mimetics, and in the incretin mimetics we have exenatide and liraglutide.